Hello and welcome, everyone. Thank you for being here today to learn more about how pelvic floor physical therapy can help you navigate your fertility journey. I'm Dr. Mallory, a pelvic floor physical therapist, co-founder, and fertility-focused practitioner here at Tonic Phasic Holistic Pelvic Health. Today, we're going to go over navigating infertility with an integrative pelvic floor physical therapy approach. Again, my name is Dr. Mallory. This is a little bit more about me. Some of my specialties are unexplained pelvic pain, endometriosis, infertility, pain with sex and trauma, regarding sexual birth and medical trauma. What began my journey into pelvic health was my own personal experience with pelvic pain. So that's a little backstory about me. We'll learn further some of those evidence-based techniques that I use, such as pain reprocessing therapy and visceral mobilization specifically, and hormone health coaching. Now, before we begin, I want to acknowledge the complexity and the emotional heaviness of the journey you're on. It often can come with physical, emotional, and mental strain, and want you to know you don't have to carry this alone anymore. My role here is to help lighten that load by guiding you and providing clear, evidence-informed fertility support. Whether you're actively trying to conceive, undergoing IVF, planning ahead, or simply aiming to better understand your body, I hope you know that we created this space for you. So let's get started. Basic clinical definition of infertility. Infertility is defined as trying to conceive for longer than 12 months, or 6 months if you're over the age of 35. And while that's textbook definition, I want to take a moment to remind you that behind every statistic is a real human experience, that this isn't just a number, it's a journey that affects 1 in 6 individuals worldwide. And our goal here is to get you the support that you deserve. And with that, you might have heard of the word unexplained infertility or have been diagnosed with that. And it's a really frustrating phrase. I want to unravel that a bit more so it's clear. Unexplained doesn't mean that nothing is happening. It simply means that what's going on hasn't been fully identified yet. Now, what does that mean? There can be many contributing factors that often get overlooked or brushed aside. Things like hormonal imbalances, including thyroid function, egg or sperm quality, which isn't always captured in standard testing. Structural concerns like fibroids, endometriosis, or scar tissue, nervous system dysregulation, environmental or lifestyle stressors, but most importantly, the role of structural and biomechanical factors impacting infertility. Now, those key physical barriers can include pelvic and abdominal tension, scar tissue and adhesions, and restricted blood flow. And that is what we're going to highlight tonight. We're going to go over a 6-step framework to support fertility. It's a holistic approach that we develop to help you align with your body, your cycle, and your nervous system. So steps 1 through 3, we're going to briefly touch on coaching and lifestyle tools to deepen your connection. Step 4, we're going to dive deeply into body mechanics and pelvic floor therapy. And the last steps, 5 through 6, we're going to work on how to understand to build your referral network or any type of imaging or labs that you may need. Step 1, laying the groundwork. We're going to start at that foundational level before we even jump into ovulation tracking, lab work, or imaging. We want to take a pause because fertility begins with safety. During your first session, we're going to walk through your journey and listen to your story. We're going to ask things about your pelvic health, about your sleep, your nervous system, any supplements you're on, and most importantly, too, how intimacy is for you. Sometimes the biggest barrier for people could be the connection and intercourse itself. If you have pain with intercourse, it could prevent you from trying to conceive. So, with that being said, working on that pain you're experiencing with intercourse could be that first step towards conception. Now, we always start very basic. When we get to know you, it's a prenatal omega-3 and CoQ10 that we highly recommend. So if you're listening to this, that's definitely something to start with. Making sure you're getting reputable brands such as WeNatal or Seeking Health or even Needed. Those are all great quality brands. When we talk about nervous system regulation, those are things that we process and walk through, whether that's emotional, whether that's physical, whether that's just the journey itself. That is something we process and work through body work and a technique that I'm trained in called pain reprocessing therapy. And quality sleep, which is the foundation of hormone regulation. Step 2 is cycle awareness and education. So we're going to assess your menstrual cycle itself. We're going to assess that cycle. I'm going to ask you questions on if they're heavy, if they're painful, are they missing, clotty, scanty, are they 28 days, 35 days, longer than that, shorter than that, 21 days. Your period and your menstrual cycle tells us a story on where to start. And with that comes menstrual cycle education, where we'll teach you the four phases. We'll teach you how to support yourself in each of these phases. Over here, it's pretty cool. You'll see that this is the process of an egg releasing. So it starts in that hypothalamus, it releases hormones to that pituitary, releases more hormones to the ovaries. Ovaries then trigger that egg to release. The egg comes out and it can be fertilized. And as it's fertilized, it's either going to implant or if it's not fertilized, it sheds, and that's how we start our period. So we are going to heavily dive deep into that menstrual cycle story for you. We'll teach you how to track your basal body temperature, which is an important biomarker for fertility, making sure we're seeing that increase in body temperature post-ovulation and how long you're in your luteal phase post-ovulation. We're going to talk about cervical mucus, cervix positioning, vaginal pH, and microbiome, how that can affect, and urine hormone tracking systems and devices like the Mirror or Nido. And we might even talk about LH strips for fun. Now, I say for fun because LH strips tells us a story. It doesn't give us the whole picture. Sometimes you can get a positive LH strip multiple times, which then if you have intercourse on that first positive test, but don't have intercourse on that second, you could have missed your window. That's called attempted ovulation, where you're not actually ovulating because LH doesn't determine ovulation. It just determines the LH surge. That's a very important thing I like to teach people. After we look into your menstrual cycle, we jump into lifestyle shifts based on what we're seeing through your chart. If you're tracking your hormones through your urine, such as Mira, anything that we get from that information. We'll then focus on proper lifestyle support, such as nutrition, hydration, exercise, maybe even doing some swaps with endocrine disruptors, giving you some suggestions, or even some supplements and herbs. For example, if we need more liver support, I might recommend burdock or dandelion, or if there's some stress responses that's inhibiting ovulation or having a delayed ovulation, I might recommend ashwagandha or skullcap. Or maybe your luteal phase is not long enough, I might recommend Vitex or wild yam. Step 4, body mobility and fertility. This is one of the deepest part we're going to get into, so you can learn more about how pelvic floor physical therapy can support infertility from that biomechanical or structural portion. And with that being said, the reason why this is important is because research shows that improving blood flow and reducing pelvic adhesions can significantly support ovarian and uterine function. When we have restrictions from tension, scars, or holding patterns, that can limit the amount of blood flow and obviously mobility to that tissue. And when we're trying to conceive, we want to make sure that all of those structures are warm, movable, a bunch of blood flow because we need that to support the growing embryo that's implanting into the uterus. So how do we do this? We do this through a comprehensive assessment, which includes external assessments and internal. With the external assessment, we're going to look at your abdominal wall, checking in on that uterus, ovaries, and the mobility of your tissues. We also do pelvic exam externally, assessing the way your hips are moving, assessing the way that your pelvic floor is externally. And lastly, an internal pelvic exam. With your consent, we'll look at different structures, including the uterus, ovaries, fallopian tubes, a little region that's between the uterus and the colon, which I'll explain later. We'll also look at that colon, cervix, pelvic floor. And then lastly, like I said, the abdominal and spinal hip muscles. Those are all hands-on treatments and comprehensive assessments that we're going to look at externally and then internally on those tissues that we can get to. And the techniques we use during these treatments include visceral mobilization to improve circulation and reduce adhesions, movement and nervous system regulation for holistic support, and other techniques such as that pain reprocessing therapy, vagus nerve stimulations, and so forth. Now, I added these images on these next slides to show you what we're talking about. Now, cervix is right here. You have the vagina right here. When we insert, we look at the mobility of that cervix. We'll learn further on there's some surgeries that can cause scar tissue over here. And typically, what I like to tell patients is depending on where you are in your cycle, your cervix should be feeling different. It also should be at a different position. So, for quick reference, we use the acronym SHOW when you're ovulating: soft, high, open, wet. So it should feel like your lips. So touch your lips, and that's what your cervix should feel like when you're ovulating. Now, when you're not ovulating, it should feel a little bit harder like your nose. And then my little side thing I like to say is it shouldn't feel like your ear. So you know that little cartilage that you have right by your ear? If you play with that cartilage, it shouldn't feel like that. And sometimes when I get patients and clients, it definitely feels like that. And there's a history of an IUD or a LEAP procedure that we'll soon learn about. There could be, any biopsies from an abnormal pap smear. So the cervix plays a huge role. Other tissues that we look at is all the ligaments of that uterus. Oftentimes they can be really restricted and tight, which then can impact that blood flow to that uterus. So we like to move in the directions. We like to move the uterus from side to side. We like to see if we can kind of move it this way, a little bit up and down. So that's part of that. And then we also like to look at the ovaries, how that moves internally. So we come in with the finger and we come out to the side and we kind of work on that ovary, see if we can reach up to that fallopian tube. Really, we're trying to stimulate that area to bring more blood flow, just to signal that that body structure is safe and it can move. Now, this image shows the close proximity of the bladder, the uterus, and the rectum. Now, right here's the cervix, like we just mentioned. This space right here is you have uterus, and then right here behind that cervix is called the recto-uterine pouch. And for a lot of people, that can be very tight and what we say, quote unquote, sticky. And when we do that assessment, we make sure that this isn't getting pulled back, which then can align that cervix in an unfavorable way. So we like to work on that area. Now, the orientation of that uterus could be something else that we look into. And then lastly, we want to make sure right here that that pelvic floor is nice and supple. So over here, you're going to get an appreciation of all the structures that surround the pelvis. Here are the ligamentous tissues that surround the pelvis. We have a bunch of muscles that go in through and connect to the pelvis. And then we have that pelvic floor. All of these can impact fertility in a way that puts your uterus in, again, that unfavorable position, which then can tension that cervix. And remember, we want that cervix nice and soft. We want that uterus warm and mobile. Now, this is to summarize that we work directly with the uterus, ovaries, fallopian tubes, cervix, colon, rectal uterine pouch to promote optimal mobility and circulation because when structures are restricted or tense, blood flow can be compromised, and our goal is to release adhesions, reduce tension, and restore circulation, which is all essential for fertility. So, with that being said, tension patterns in the pelvis or abdomen can pull the cervix or other organs into suboptimal positions, making it more difficult for sperm to reach the uterus. For some, pain with intercourse caused by the internal tension of the pelvic floor or the abdomen or hips can become that silent barrier to conception. And that's what we do here. We help you uncover and treat these patterns through targeted visceral myofascial work with the add-ons of all the other physical therapy aspects that we do, like exercise, mobility techniques, breath work, and coordination factors. Now, who does this support? Visceral myofascial work helps support people who have gone through or experienced endometriosis related adhesions, whether that's from the lesions or the surgery itself. People who've had a C-section, so this would be called secondary infertility from that scar tissue of the C-section itself. Or if you've experienced any abdominal surgeries, such as an appendix removal or any things of that nature. We have that LEAP procedure we spoke about earlier, which is a cervical biopsies when they find abnormal pap smears. It could be a fibroid with or without removals. If you've had partial tubal blockage, again, that pain with intercourse or cervix misalignment, organ adhesions through what we'll learn about emotional stressors. If you've gone through egg retrievals, which can make the pelvic side walls tight and tense. And the last thing is people who are going through IVF, this work can help support transfers. Now, how do these even develop? Structural restrictions can be a result of inflammation, scar tissue development, or connective tissue tension from pain or holding patterns. Here are other aspects if it's not the musculoskeletal system that's causing it. Now we have primary and secondary tension from the body. Primary would be that musculoskeletal tension, whether that you have abnormal movements or, I don't know, you're doing some sort of sports specific work or you are having holding patterns in a way that causes musculoskeletal tension. Now, two other reasons, one of them being when tension isn't primary and it's secondary, a result of, we look at that nervous system and emotion patterns. So when that sympathetic nervous system is overactive, that fight or flight response, the body can shift into protection mode. And with protection mode, we tend to get more into a tense position. When you're in that fight mode, your jaw can clench. If your jaw clenches, that can involve the pelvic floor. If you are in that flight response, a little bit worry or fearful, we might tighten around ourselves or come more into that fetal position. So, sympathetic nervous system activates our musculoskeletal system, which causes tension. So, the tension would be secondary to the sympathetic nervous system activation. The second thing that could happen are emotions. And when we have emotions, they can manifest physically. Remember that whole saying, the body keeps a score. It's very true. And some of the things that we kind of share is that on a more spiritual aspect, fear can be connected to the bladder. Worry can be connected to the colon, and trauma can be connected to the womb and pelvic floor. So the whole point of this is we need to understand is it secondary or if it's primary? Because if it's secondary tension and we're treating the body, but we're not resolving your nervous system or the emotions and processing that, the tension will still remain. It'll be hard to kind of move through with it. So that's one of the biggest things that we try to figure out, this mind-body connection. Where is this tension coming from? And once we do, we go through processes to release that physical and emotional tension. It could look like a jaw and pelvic floor release. It can look like hip mobility or lymphatic drainage, pain reprocessing therapy, and emotional mapping, vagus nerve stimulation, such as humming, breath work, cold exposure. It really depends on what we're trying to get to. But there are a plethora of things that we can go through to figure out how can we support you and the goals that you have. Now, another reason why someone could develop tension in the body through the herbal lens, we categorize tissue states and we have hot, cold, dry, damp, tense, lax. And so those are tissue states within the body. Dryness is a tissue state that's tied to both physical and emotional depletion, which can cause symptoms which can contribute to infertility. So, what are some of those signs? You can have vaginal dryness, scanty periods, which means that you're really not bleeding much or long. Maybe some people say there's spotting here or there and they use a liner. That's a scanty period. The next concept could be minimal to no cervical mucus. And what that looks like is dryness throughout the entire menstrual cycle, or maybe not even experience that fertile mucus, which is that egg white discharge. Sometimes some people might have more kind of dry cervical mucus where you can kind of roll that cervical mucus and can break up a little bit. That would be signs of dry tissue state. The other examples could be pelvic pain and constipation, dry skin, and tension. Now, dryness often overlaps and connected to chronic stress, trauma, and burnout, which dries out the body, influencing fertility. Now, typically, if someone comes in with a dry state, a demulcent is something like a simple recommendation that might be given. Maybe that's slippery elm, or would it be depending on if it's vaginal dryness or the cervical mucus that we're trying to get to? It would really depend on what we're experiencing. That's where the specific herb recommendation will come from. Okay, so we reviewed all the body and how that can contribute to your fertility experience. Next thing, step five, are labs and imaging support. So let's say you've done all the foundations, you tracked your cycle, everything's looking good, you've ran some blood work, everything's good. Those next steps are getting comprehensive support. What that looks like is not just getting a transvaginal ultrasound to assess fertility status, such as the antral follicle count, the AFC, but also including the uterine position, checking for fibroids, polyps, ovarian cysts, and even possible adhesions. There's a test called the sliding sign where reproductive endocrinologists and fertility specialists will go in and put in the transvaginal ultrasound head and push on the sides of the pelvic wall. And what they'll find is tension between that ovary and the uterus, or ovary and the rectum, or the rectum and the uterus. And that gives us insight as pelvic or physical therapists to go in there and assess that tissue state to see if we can open up that space, help you move through that space, breathe through that space so that there's less adhesions and more blood flow stimulation. Next things we're going to look into is comprehensive lab work. Typically, they don't include a full hormone panel, and that's something we'll seek out. It must include not only that AMH, LH, FSH, estrogen, progesterone, but we want to look at sex hormone binding globulin. We want to look at testosterone and free testosterone, DHEA, DHT. I mean, prolactin's another big one to kind of look into. There's a lot more to include because each of these hormones tell a story of the process of where you are. There's also a full thyroid panel. Typically, they just TSH, free T3, free T4. We also want to know those antibodies too, because that's going to show if there's any immune activation occurring within that thyroid. Even though there's no disease or damage, you can have an immune response. So, very important to look at the antibodies. Now, I typically recommend people go to their primary care provider if they can kind of get that for them. And if they cannot, there's other resources out there. Function Health Labs is one of them. They run a full thyroid and full hormone panel, which is super nice. We can also do functional medicine or naturopathic doctors. They definitely will do a full lab workup. So the important thing is that you get everything to include to figure out what is going on. We might do a GI map. This assesses gut health, the microbiome, inflammation, which can impact hormone function and fertility. I really like doing this one because it actually overlaps with the vaginal microbiome. So I like doing both the GI map and vaginal microbiome test, which is called the EVI. Doing those hand in hand definitely gives us a lot of information to see if there's any crossover or, leaky gut that's happening. And lastly, partner testing. Definitely a missing piece, making sure that they're getting a full hormone lab and full labs. GI map included semen analysis, which is typical to assess that motility, morphology, and count. We're just trying to get them from every end, making sure that they're also on a prenatal and supporting their semen quality. Step six. This is where we really advance our surgical and referral route, where we might have to collaborate and look into other reasons why conception is not happening. One of them is called an HSG. An HSG is an X-ray which goes in and checks to see if the fallopian tubes are dilated and open. There's multiple procedures that can happen thereafter. If there's a partial blockage, that's something we can support here with body work and with reducing inflammation. However, if it's a full, complete block tube, that's something that bodywork can't really support. However, what I say is that we can support your body still for the next procedure. So if there has to be a removal, we're at least helping you open up that tissue and helping you recover after. Endometriosis excision, this is the gold standard to diagnose and to treat, so remove the endo lesions. Oftentimes, one of the biggest missing link is endometriosis. I think the statistic is about 30% of people who have endometriosis experience infertility, but about 50% of people who are experiencing infertility have endometriosis. So with that being said, it's definitely something that I work really closely with our local excision specialist to help you get those answers. oftentimes people do get pregnant after these procedures and surgeries. Next is a myomectomy. That's a surgical removal of the fibroids, which, depending on which type of fibroid you have, there's three different types, can truly impact implantation. Now, one of the examples I'm going to give is a fibroid that grows within the uterine cavity. And so within that tissue, what could happen is you're getting pregnant, but when the embryo is going to implant onto the wall of that uterus, if the fibroid is in that place, then your embryo is going to implant on the fibroid, which doesn't have the proper home to sustain that embryo. So with the lack of blood flow and support, that is when unfortunate miscarriage happens. So if you're going through recurrent miscarriages, this is something definitely to look into to see if you have a fibroid and see if you have the one that grows within inside the pelvic wall or the uterine wall. Other things we can talk about is intracervical insemination, which is typically at home people perform this where they get the sperm, place it up into the cervix through syringes. Next, a couple things that are guided by the reproductive endocrinologist and infertility specialists, which is timed intercourse, intrauterine insemination, and IVF. So all three of those are kind of even the framework of how they go about it. They'll probably start with timed intercourse. IUI, they take the sperm, they wash it, insert it, kind of like the ICI above, but this is done through the REIs at their clinics and they properly place it into the uterus. Then we have the IVF route, which you fertilize the egg after you retrieve your egg. You fertilize your eggs with the sperm outside of the body, and as the embryo is created, is then transferred within the body. We also have donor egg or sperm, and this is used when there is either low ovarian reserve or sperm count. There's also donor embryos. There's surrogacy and there's adoption. So the reason why I go through this last step is at the end of the day, if a family is something you're seeking, I like to tell my patients that we'll get there. And it could look like the path that you want, or it can take a little detour to where you wanted to go, but still end up at the destination that you've been hoping for. So, with that being said, we go through all six of these phases to figure out where it is you need to be. Maybe you come and see me and you're at step 6. Then we'll step back and see, did you do anything to support your menstrual cycle? Was there any body work? Is there any tension? Have you had any surgeries? Is there anything else we're missing? And so we can take a step back and walk forward again. With that being said, there's two ways we can work together. And those two ways are through unexplained infertility work, which again, I'll review your full health picture, lifestyle stress, cycle, pelvic health, and your fertility journey to kind of see where you are in this 6-step framework. Then we'll go through that approach and figure out what is going on and better support your chances of conception, but truly helping guide you through your next steps and possibly including different referrals, even acupuncture. We have such a big network that we like to work together and collaborate with to give you everything that you deserve during this time. So that's option 1. Option 2 is Mercier therapy, which is strictly only body work. What we mean by that is from that step 1 through 6, it is specifically working on step 4 with the strategic pelvic bodywork strategy that we implement for a couple sessions. So, what is Mercier therapy? Mercier therapy is a deep visceral external pelvic mobilization technique, and the goal is that it improves mobility of the reproductive organs, it increases blood flow, and releases those tensions and restrictions we've been talking about. This was developed by Dr. Jennifer Mercier, and she created the Shared Fertility Journey program. And with that, just to break it down so it makes a little bit more sense, you get an initial session where we're going to get to know you and understand your experiences, which is going to be separate from the price that we're establishing below. From there, we're going to give you a supplement recommendation, and that first round is going to be on us so that we can better support you as you're getting started in this journey. Then you're going to have 6 Mercier therapy sessions weekly, and they're going to last about 55 minutes, and that's where we do all of the body work. Now, after those 6 sessions, let's say conception does not happen. You're then going to do cycle charting for 3 months, and we can check in here and there during that time. After those 3 months of cycle charting, you're going to come back in and you'll get a follow-up session, which is going to include that 3-month cycle review plus an additional bodywork session during that time. Now, if you have not been able to conceive even at that point, do not even worry. These bodywork sessions last for up to a year of the start of your program. So we'll do monthly bodywork check-ins, so Mercier therapy once a month until you achieve a positive pregnancy test. Or again, like I said, for up to that 1 year from the start of your program, whichever one truly comes first. And all that comes out to $3,000. Now, I know that was a lot. And to recap that, remember step 1, fertility foundations. Step 2, menstrual cycle support. Step 3, we got that lifestyle shift and optimization. Step 4 is all that body work we went through. Step 5 is further specific lab testing and procedures. And then step 6 are the different diagnostic procedures we can go through and assistive reproductive technology support that we can get and everything else that can lead us to that final destination we're on. And those 2 types of way to work with me, whether that's unexplained infertility or you want to go through Mercier therapy. With all that being said, thank you so much for being here and for trusting me to be a part of your fertility journey. My hope is that you're leaving this space feeling more informed, supported, and empowered. If you have any questions or if there's something you'd like to explore more deeply, please don't hesitate to reach out. You'll find our email listed right here on this slide. And we truly welcome any question, thoughts, or next steps you may be considering. So please do not hesitate to reach out. Thank you again. I'm very much wishing you clarity, connection, and care as you continue to move forward through your journey. And know that we're here to support you whenever you need us. Thank you.